So let's look at the major bones of the mandible. So there's many that's listed over here, and I'll go over the main ones that you need to know. So one of the things is when you look at the mandible, which is the bottom jaw, what you'll notice is this part over here is known as the condyle. Sometimes it's also known as the, I'm just trying to see over here, mandibular condyle. Okay, so it's a mandibular condyle, okay, or articulating surface of the condyle. Just remember condyle. So how can you remember this? Well, when you look at this word over here, it has the word dial. So think of condyle for dial. And think of, you know how when you're, if there's a phone and there's no, think of the old phone, and you know how you would dial the phone, and you would take the phone and you would dial it this way, like the old phones. This is what we're talking about. So think of like a curve, the condyle. It's a curve and it's like a dial. Like think of the phone, condyle process. The reason why I say that is because the opposite is more pointy. This is the coronoid process, but the condyle, they think of a phone that's an old phone that you're dialing, or think of like, you're opening a vault and you have to undo the lock, or you have to figure out the lock and you have to turn the lock. You can also think of it like that. So it's a condyle, and this is something that's projecting out. That's more pointier is the coronoid process. Another thing to note are the holes, are the foramen. So there's a mental foramen over here. So there's a hole over here. It's a mental foramen. So if the dentist wants to numb this area over here and drill some teeth over here, they would inject or put the needle somewhere over here to numb the area around here. Remember that this is the body. So remember, think of the person lying down. It's a horizontal body. Think of this as a ramp going up. So this is the ramus. Okay, so a ramp that goes up. So it's a ramus. And then this is your alveolar process. So all the bone that's surrounding the tooth, or the bone that's closest to the tooth, is known as your alveolar process. Okay, and then this over here is known as an angle. So sometimes you might see, they might ask you test questions about the mandibular angle and what's near the mandibular angle. So think of like this is the angle, right? So this right where corner is known as your angle. Sometimes you'll see something called a retromolar triangle, which is, if you remember in the maxillary, we were looking at the maxillary tuberosity, which is the area of the bone that's just behind the last molar. Well, there's something in the mandible as well. So there's something at the bottom as well. And the area behind the molar is called the retromolar pad or retromolar triangle. It's the area that's right behind the third molar. So just like the top has a maxillary tuberosity, the bottom has a retromolar triangle. Now, when you look at this on the inside view of the, or posterior view rather, of the mandible, again, here is the condyle, here is the coronoid process. Do you see this hole over here? Remember, holes are foramens, and this hole on the inside is known as the mandibular foramen. Okay, so mandibular foramen. Sometimes you can see bumps over here, which is directly underneath the incisor area, and those bumps are known as the genial tubercles. So let's recap. Genial tubercles, alveolar process, which is the bones around the tooth, retromolar triangle, which is the bone right behind the last molar, the third molar at the bottom, coronoid process, condyle, mandibular condyle, and this hole is your mandibular foramen. We're looking at it as another view. So if you look at it, this is the coronoid process, something sticking out. This is the condyle. This is the mandibular foramen. And then you can see there's other terms as well. So one of the things you'll know is the tongue is over here, and the tongue is also known as the lingual side of the mouth. So the inside is known as the tongue. And when we look at the lingual side, this area over here, because it's close to the tongue, is known as lingula. And then we're looking at sublingual fossa. I don't want you to worry about this too much because you're going to learn new terms in the other courses. But when you hear the word lingual, think of tongue. Okay, so this is where the tongue is. And the fossa is like a depression. So this area over here is a depression, so it's a sublingual fossa. Sub means bottom, because it's on the bottom. Lingual means tongue, so it's in the tongue area. Fossa means depression, so this is like a depression here. Okay, that's all for today. I do encourage you guys to watch these other two videos that you would see posted on Blackboard. If you have any questions, don't hesitate to ask. Thanks, guys.